Dr. Fox, we get a lot of questions regarding PCOS. How does a woman know if she's struggling with symptoms of PCOS?
So there are a variety of symptoms for PCOS. The most common symptoms relate to irregular menstrual cycles and skin changes, such as acne, oily skin, facial hair. Even some patients lose scalp hair, and that's a result of the higher male hormone levels that we see in PCOS. They also typically will have weight gain and will be, overweight or obese. But the cycle length goes from what's normal, which is 28 days, it actually extends out to 35 or more days in patients with PCOS.
Is there any testing to know for sure if a patient is struggling with PCOS?
So there is testing, but the interesting thing about PCOS, which there are some other medical conditions that fall into this category, but PCOS actually is a diagnosis of exclusion. So it's not like we do a test for the disease and it's positive and that says we have the disease. In PCOS, we use the clinical findings of ultrasound abnormality, prolonged cycles, and any evidence of elevated male hormones to then say that a woman has PCOS. They have to have 2 out of 3 of those clinical characteristics. Then the lab testing that we do actually rules out other diseases that can mimic PCOS. So we do look at things like thyroid and prolactin levels, which relate to the milk hormone production. And then we rule out some other even more rare enzyme deficiencies in the adrenal gland that's involved in cortisol and hormone production. But if those tests are all normal, which they are in the vast majority of patients with PCOS, then they have the clinical syndrome and we give them a diagnosis of PCOS.